state your name and who you work for.
Kevin Lindamood with Healthcare for the Homeless.
And what Bmore Health Talks were you just on?
Was just on a Bmore Health Talks about healthcare and health insurance.
And are there any final words that you didn't get a chance to say?
I think the general consensus in the room was that we've come a long way with health reform in improving access to care, particularly ensuring low-income adults that previously had no access to Medicaid, as well as those with slightly higher incomes that now have access to subsidized care, but that we all have a heck of a long way to go to bring everyone in and leave nobody out. And unfortunately, the U.S. remains virtually alone among other rich countries in not guaranteeing access to health insurance as a right of citizenship. So I was really surprised and delighted by the consensus in the room that we needed to continue our advocacy work to bring everyone in and leave no one out. And also there was great consensus that we needed to do more to ensure that now having insurance translated into actual access to care and into improved health. And that begins by expanding what we have traditionally thought of as health. In our case at Healthcare for the Homeless, we know that housing is in fact healthcare, and that once extremely vulnerable people get access to housing and to the supportive services that they need to stay there, they stay off the streets long term, go to the emergency room far less often, and actually experience dramatically improved health and overall quality of life. The consensus in the room very much captured all of that. I think that we've come a long way and we've got a lot farther to go together.